patient's care plan. The patient's care plan is individualized for each patient based on his/her needs in long-term care and home health care services. It is developed to achieve the goals of care provided to the patient. It lists tasks that home health aides must perform. It states how often these tasks should be performed for the patient and how they should be carried out by the home health aide. The care plan is a guide to help the patient attain and maintain the best possible level of health and daily function. It must be followed very carefully. Activities not listed on the care plan should not be performed. However, it is ultimately important for an home health aide to make observations and report all changes to the coordinator in the agency. The information collected will be used to determine how the patient's care plan needs to change and meet ongoing needs. Care planning involves input from the patient and his/her family, as well as from all healthcare professionals providing care and health services to this patient. When the patient is involved in care planning, he/she is more likely to participate in his/her own care and continue the prescribed treatment and home care services. In addition, each patient has a legal right to participate in his/her own care process by making choices, decisions and preferences as of how care should be delivered. When the care plan is created, the patient is assessed for his/her physical, mental, psychological, functional and socioeconomic needs, as well as ability and the level of assistance required in performance of different activities of daily living. Then, a nurse will elaborate the care plan tasks that can help the patient achieve his/her goals of care, priorities and expectations, maximizing independence and self-care. The care plan is prepared by the nurse at initial admission of the patient and then every 6 months. The care plan may be updated more frequently, if the patient's condition or home care needs have changed. There will be one care plan for an home health aide to follow. Home health aide follows the patient's care plan and carries out instructions given by a nurse. The nurse is acting on the recommendations of the patient's doctor. This is called the chain of command. It describes the line of authority and helps to make sure that patients get proper health care. It also protects employees and the agency from liability, the legal term that means someone can be held responsible for harming someone else. For example, if an home health aide does something not in the care plan that harms a patient, he/she could be held responsible. That is why it is always important to carry out instructions in the patient's care plan and follow the chain of command in the agency by reporting and communicating changes in the patient's health, functional status, mental status and so on. Other reportable events include hospitalizations, falls, bed sores, abuse, neglect, etc. Home health aides must understand what they can and cannot do. It is necessary, so that they do not harm patients, protect themselves and do not involve themselves in lawsuits. The care plan provides you all necessary instructions for giving proper care to the patient. You should read the care plan at the beginning of your work shift, even if you read it before, to check if there have been any recent changes to the patient's care. Call the agency's office at 347-492-5982 if you may have any questions about the care plan. Call the agency's office at 347-492-5982 if you are unable to locate the care plan in the patient's home. Perform only the tasks that are checked on the care plan. Notify the agency's office at 347-492-5982 if the patient requests anything not listed on the care plan, or if you are not knowledgeable or comfortable to perform the assigned care. Following the care plan means that you provide care as directed and that you will be able to report any problems or concerns related to the patient's care. It is the policy of First Choice Home Care Services, Incorporated, to comply with all applicable laws that require records to be maintained of the hours worked by our employees. Your record of work hours is the way of communicating to the agency on what days you provided care to the patient, how many hours you worked for the patient, and what care tasks you performed for the patient. You must follow the patient's care plan. Document only the tasks that were actually performed and only the actual times and days when the services were provided to the patient. You must notify your coordinator if the patient may refuse any task on the care plan or may refuse the services completely. Your work record is considered a legal record of care provided to the patient. It is a permanent part of the patient's chart. It can be used as an evidence in a court of law. It helps the agency to receive the payment for services. It helps the agency process your weekly pay for the hours worked in a timely manner, so you can receive the payment on your check for all the hours you worked without any delays. Inaccurate and incomplete documentation, or your failure to provide records of your work hours on time can delay processing or cause inconsistencies in your weekly paycheck. The 21st Century Cures Act is a federal law passed by Congress in December 2016. It requires all state Medicaid programs to implement an F system for personal care services, PCS, and home health care services, HHCS. Beginning January 1, 2021, all New York State providers must implement an F system to avoid a reduction in federal Medicaid funding, and all New York State service recipients must comply with the F requirements of the New York State Department of Health (NYSDO) to validate their work hours on a real-time basis. As of January 1, 2021, as per directions of the NYSDO and Medicaid, all home health aides will be required to clock in and clock out when they start and finish work for patients. You must use electronic visit verification (EV) system, or you must install a mobile app on your phone that can also be used for clock in and clock out. Both EV and mobile app features are maintained by Home Health Aid Exchange, a software approved by the NYSDO and currently used by First Choice Home Care Services, Incorporated. If you are already clocking in and out for work, you do not need to take any further action. If you are not clocking in and out and require training or installation of a mobile app, you should contact the agency's office at 347-492-5982, so we can help you arrange the necessary training or installation of the app. Beginning January 1, 2021, home health aides must record their work time by clocking in and out or using a mobile app. Clock in and out instructions, as well as mobile app instructions, are available in the agency. If you may require training or need a copy of the instructions, you must call the agency as soon as possible. The agency will stop accepting paper time sheets as of January 1, 2021. To receive your paycheck on time and prevent any delays, you must clock in and out for work, or use a mobile app on your phone to record your work hours. If you select the EV option, you must only use the patient's phone to clock in and clock out for work. You are not permitted to use your personal phone for clock in and clock out. First Choice Home Care Services, Incorporated strongly recommends home health aides to begin clocking in and clocking out for work before January 1, 2021. If you may need any additional instruction how to clock in and clock out or use a mobile app for recording your work hours, please call the agency's office at 347-492-5982 and speak to your coordinator or HR department. No. Reporting. When making any kind of report, the right kind of information must be collected before documenting it. Facts, not opinions, are most useful to the agency's personnel and the care team. Two kinds of information are needed in reporting. 1. Objective information. This information is based on what a person sees, smells, touches or hears. Objective information is collected by using the senses. It is also called signs. Objective observations made with your eyes, what you can see. Skin, color, bruising, swelling. Bowel, color, amount, consistency. Urine, color, amount, frequency. Facial expressions, grimacing, crying. Any changes in patient's appearance. Objective observations made with your nose, what you can smell. Body or breath odor. Environment, such as unusual chemical odor or gas leak. Objective observations made with your fingers, what you can feel by touch. Skin temperature. Pulse. Objective observations based on what you can hear, patient's words, tone of voice, breathing. Null. Why is objective information important? Medical purpose serves as the communication between healthcare providers. Legal purpose can be used in courts. 2. Subjective information. This information is something a person cannot or did not observe, but is based on something that the patient reported, which may or may not be true. It is also called symptoms. An example of objective information is, the patient is holding her head and rubbing her temples. A subjective report of the same situation might be, patient states that she has a headache. The agency's personnel and the care team need information to make decisions about care and treatment. Both objective and subjective reports are valuable. The information reported must be significant and useful. In any report, what is observed, signs, and what the patient reports, symptoms, need to be clearly noted. Home health aides are not expected to make diagnoses based on signs and symptoms. This is beyond their scope of practice. However, their observations can alert the care team to possible patient problems. A home health aide is the agency's eyes and ears in the patient's home. It is the home health aide's duty to observe, report and record any changes in patient's health condition or all activities, deemed unsafe or dangerous, that may jeopardize the patient's or the home health aide's safety. Such activities include changes in the patient's health condition, physical, mental, functional or social status, environmental conditions and changes that affect the patient, changes in supportive relationships with relatives, friends, physical conditions of the home. The coordinator's responsibility, once made aware of these issues, is to document all issues, incidents reported, patient falls, hospitalizations, theft, bed bug infestation, patient abuse, harassment, neglect, pressure ulcers, bed sores, illicit drug use or possession of guns in the home. Fill out incident reports as needed and obtain written statements from home health aides. Inform the patient's case manager and supervisor in the agency's office. Perform all other necessary follow-ups to ensure the issues have been addressed in full and resolved. Appropriate reporting and documentation of all patient care or services-related issues to help the home care team identify any changes in the patient's status and determine the patient's needs for additional services. As a home health aide, you must report to the agency the following events, incidents or changes related to your assigned patient: refusal of care, falls, hospitalizations. When the patient is hospitalized, no work should be performed for the patient. Physical and mental changes, such as skin rash, redness or sores. Changes in skin color, pale or flushed. Difficulty speaking or understanding. Dizziness. Pain. Swelling. Unusual sweating. Cough or wheezing. Unusual appetite, decreased or increased. Lack of energy. Unusual incontinence. Stomach or intestinal distress. Any signs of abuse, bruising. Unusual sadness or depression. Unusual forgetfulness. Change in personality. The above list is just a guideline provided to you. You must call the agency, even if you have concerns that are not on this list. The Code of Conduct sets the standard of conduct expected of home health aides that outlines the behavior and attitudes to which the employees must adhere after signing up to the code when applying for work with the agency and being oriented to the job responsibilities and the agency's policies and procedures. The Code of Conduct requires employees, including home health aides, to follow all policies and procedures of First Choice Home Care Services, Incorporated. In addition, the employees should adhere to all federal, state and local laws regulating home care industry, as well as professional and ethical standards relating to each employee's license or certification to perform the job. The Code of Conduct describes the legal, ethical and behavioral standards that are applicable to and expected of all employees, including the consequences for failure to maintain these standards. As employees of First Choice Home Care Services, Incorporated and members of the agency's team, home health aides are expected to conduct their job responsibilities, adhere to acceptable work practices in matters related to professional conduct, and always exhibit a high degree of personal integrity when providing home care to patients. One of the key requirements to the conduct of a home health aide is to maintain compliance with the agency's policies and procedures. The policies and procedures have been developed to give quality care to patients, provide adequate guidance to all employees about their job, as well as protect both patients and employees from the consequences of misconduct. Misconduct is a behavior that is wrongful, improper, unlawful and unacceptable in the workplace. Home health aides should always follow the agency's policies and procedures to prevent any forms of misconduct while at work and caring for patients. Procedures may seem long and complicated, but each step is important. The following list enumerates the types of conduct that is not acceptable of all first-choice home care services, Incorporated S employees, and is considered a violation to the code of conduct established by the agency. This list is not all-inclusive, but all the forms of misconduct at work can become a cause for disciplinary action, up to and including termination of employment, patient abuse, neglect or mistreatment, violation of the agency's non-discrimination and/or sexual harassment policy, giving to or accepting money, tips, gifts or anything of value from patients and their family members, unexcused excessive absenteeism, lateness, no-call no-show or failure to arrive at the job assignment without proper notification to the agency according to the on-call and call-in-out procedures, unauthorized excessive use of patients' items or belongings for a personal reason without approval, reporting to work or the agency's office under the influence of alcohol, illicit drugs or other illegal substances, smoking in no-smoking areas in or around the patient's home, illegally manufacturing, possessing and distributing drugs while at work, stealing or willfully damaging any property of the agency's patients, co-workers or other caregivers, unprofessional dress uniform attire when reporting to work or while on the agency's premises. The list of forms of misconduct continued. Failure to follow instructions or fulfill duties within job scope or patient care plan. Fighting with or assaulting any person on the agency's premises or in the patient's home. Sleeping on the job, except while working on a live-in case. Possession of firearms or any other weapons while at work. Discussing personal affairs, the agency's internal matters or work-related problems with patients. Soliciting patients for personal or private duty home care services in competition with first-choice home care services, Incorporated. Falsification of timesheets, application forms, medicals, ID documents or other records. Failure to maintain privacy and confidentiality of patient information, HIPAA violation. Leaving a one case unattended or a patient alone who requires 24-hour supervision. Abandoning the patient on the assigned case by leaving work shift without proper notice to the agency's coordinator and without allowing to find a replacement or another relief aide to arrive at the patient's residence. Creating unsafe, hazardous or unsanitary conditions in the patient's home. No. The list of forms of misconduct continued. Conducting personal non-work-related business during work hours. Unnecessary excessive use of internet or cell phone for personal affairs, including texting, messaging, social networks, personal phone calls, listening to music, use of headphones, etc. Misrepresenting facts when applying for leave of absence or for other time off from work. Disregarding safety rules and common safety practices while on the job. Inefficiency or negligence in performance of assigned duties. Inflexibility or unwillingness to accept cases for which you submitted availability or for which you were deemed competent and refusal to switch a case assignment when requested. Illegal on-duty and off-duty conduct, such as driving while intoxicated, illicit drug use, commission of offenses and violent crimes, etc. Insubordination, threatening, intimidating, being disrespectful, impolite, rude or assaulting to patients, co-workers, coordinator, supervisor, case manager, visiting nurses or any other members of care team. Failure to meet First Choice Home Care Services, Incorporated single quote S expected level of performance, quality of care and compliance requirements. Professionalism is behaving properly when on the job. It includes being on time, performing assigned duties, finishing job tasks, dressing appropriately, speaking well with patients, their families and coworkers, as well as good communication and reporting to the coordinator of all issues and concerns related to changes in patient health, performance of tasks, work-related problems, etc. For a home health aide, professionalism means following the patient's care plan, making observations and reporting accurately and on time to the coordinator. A professional relationship with patients includes providing person-centered care, keeping a positive attitude, performing the tasks in the care plan, keeping patient information confidential, not discussing personal affairs or work-related problems with patients, not using profanity even if a patient does, never accepting gifts and money from patients, not using cell phones for personal matters on the job, being polite and respectful with patients and following mandatory safety practices, for example, hand washing, to protect yourself and patients. A professional relationship with the agency includes completing work assignments efficiently, following policies and procedures, communicating carefully and on time, reporting anything that may keep a home health aide from performing job duties and care plan tasks, reporting to the coordinator any problems with patients, asking questions or instructions if an home health aide does not know or understand something, arriving at work on time, notifying the coordinator in advance if unable to report to work, meeting the compliance requirements by providing all necessary documents to HR coordinator, such as renewed ID cards, annual medicals, etc. Attending 12-hour in-service once a year, maintaining appropriate dress code and appearance on the job, wearing the agency's ID badge, as well as being respectful, polite and tactful with patients, their families, the agency's office staff, visiting nurses and the patient's case manager. In professional relationships, boundaries must be set. Boundaries are the limits to or within relationships. Home health aides, like other healthcare professionals, are guided by ethics and laws that set limits for their relationships with patients. These boundaries help support healthy client-worker relationships. Working in patients' homes can make it difficult to honor the boundaries of professional relationships. Patients may feel that home health aides are their friends, because they spend a lot of time in their homes. When the worker and patient become personally involved with each other, it makes it more difficult to enforce rules. It also may affect the quality of work and cause a conflict of interest. For example, an home health aide may want to give a patient extra help or let the patient skip the exercise that the patient dislikes. The patient may expect the home health aide to break the rules, because she thinks that they are friends. Emotional attachments to patients are unacceptable and unprofessional. They may weaken an home health aide's judgment, as well as put the home health aide's job and overall work performance in jeopardy. Home health aides should be friendly, warm and caring with patients, but should always remain professional and stay within the limits of set boundaries, as well as within the scope of home health aide practice. The agency's policies and procedures and the patient's care plan must be strictly followed. They are in place for everyone's protection. An home health aide should ask the coordinator for instructions and help if a patient asks the home health aide to do things that. First Choice Home Care Services, Incorporated is committed to providing a safe and healthy work environment for our employees and ensuring safety of our patients as well. In this connection, First Choice Home Care Services, Incorporated makes every effort to comply with relevant federal and state occupational health and safety laws and to develop the best feasible operational policies, procedures, technologies and programs conducive to such environment. To accomplish this goal, First Choice Home Care Services, Incorporated as home health aides are expected to work diligently in order to maintain safe and healthy work conditions and to adhere to proper work practices and procedures designed to prevent injuries and illnesses in the workplace. The responsibilities of First Choice Home Care Services, Incorporated as home health aides include as follows. 1. Exercising maximum care and good judgment at work to prevent accidents and injuries. 2. Reporting all issues to your coordinator and seeking first aid for all accidents and injuries. 3. Reporting unsafe conditions, equipment or practices to the agency's personnel. 4. Using safety equipment provided by First Choice Home Care Services, Incorporated. And 5. Observing diligently all safety rules and regulations when performing work. First Choice Home Care Services, Incorporated strives to reduce the number of workplace-related injuries that employees may experience. Our goal is to keep all our employees safe. Unsafe work conditions in patients' homes must be reported to the agency's staff immediately. Unsafe work conditions include, but are not limited to, patient unable to assist with transfer. Patient or patient's family asks home health aide to perform unsafe tasks that are outside the care plan. Unsafe conditions in patient's home, deteriorating stairs, electrical issues, failure to have snow or ice removed, a new pet in the home, etc. Home health aide does not know or is unsure how to perform tasks safely. Spills are not cleaned up promptly. Clutter or other items are on the floor, increasing likelihood of trips and slips. Improper footwear. No. The 3 most common causes of work-related injuries are overexertion, slips, trips and falls, violent behavior. Please take the following precautions to guard against injury. Overexertion. Maintain proper posture. Use power grips. Use a buffer like a towel to rest your knees on when you need to be on the floor. Try not to overreach for things. Keep all necessary items at arm's length. When doing laundry, unload slowly. No. Slips, trips and falls. Be aware of your surroundings. If a floor is wet, take a minute to dry it. Always wear closed-toe shoes. Never walk around in socks or bare feet. Be careful on stairs. Take your time on unshoveled walkways. Notify the agency of unsafe work conditions. Violence. Avoid wearing hoop earrings and chains. Don't engage your patient's family in verbal fights. Notify the agency if a problem is developing. When dealing with demented patients, take care to guard against their sudden movements. Their mood can change suddenly. Keep space between you if possible. Finally, use common sense. Wash your hands often, be mindful of your environment, call the agency to report any injury, and work safely. Injuries do happen. They just don't have to happen to you. If you have any questions, please do not hesitate to contact HR department at 347-492-5982.